Many caregivers know firsthand just how profoundly Alzheimer's disease can affect one's thinking, memory, and behavior. On February 21st, Southern Arizonans are invited to attend the Conference on Successful Aging to learn ways to lower their risk of developing Alzheimer's. The conference was the brainchild of Lee Ryan, an associate professor of psychology and neurology, and Jean Alexander, a professor of psychology. The two are here to tell us more about the conference and their work imaging the brain. Lee and Jean, thanks so much for joining us today.
Thank you.
Jean, can you tell us a little bit about the conference and why it specifically is focusing on Alzheimer's?
Sure. This is a conference that Lee Ryan and I really generated the idea to have a way to provide new information to people in the community here in Tucson about the latest findings in aging and Alzheimer's disease. And today we're really happy to be able to tell you about the conference to talk about the reduced opportunity to reduce risk for Alzheimer's disease and the kinds of findings that are coming out of the research. We've established, we have a plan to provide information to the community about reducing the risk for Alzheimer's disease, and a conference that will focus on that.
And Lee, what are some of the factors that influence brain health as we age?
Well, one thing we really know about aging now is that it's complicated. So there are many different factors, and certainly some of them are things that we don't think we can have. We have a lot that we can do about, like genetics. But there are more and more factors that we're identifying that we can do something about, that we can intervene with. And so that would include things that, like obesity and diabetes, cardiovascular health in general, but also things that we didn't really think would have an impact on aging, like your everyday diet may have a very significant impact on how you age.
Could you be more specific about that diet aspect? What would be a good diet for good brain health, Lee?
Sure. The diet that most people have focused on is referred to as the Mediterranean diet, and it's a diet that's high in the kind of good fats, omega-3s, and the fats that you would find in oily fish like salmon and tuna. It's high in vegetables and fruits, but it also adds in there a little bit of red wine. So it's a diet that seems to help people to maintain cognitive function for a long period of time, and actually has been shown to decrease risk for Alzheimer's disease as well.
Wow, that's great. And Jean, your research focuses on studying normal aging versus early onset Alzheimer's. Could you tell us a little bit about your work, please?
Sure. We do research that's really focusing on trying to understand why some people do well as they age and others don't. And so by understanding how people are successful as they age, we can really try to understand ways that we can make everyone successful in aging and avoid the kinds of changes that occur as people develop Alzheimer's disease and memory problems. So we use neuroimaging kinds of techniques where we have scans of the brain that tell us about the structure and volume of the brain as well as the activity in the brain, and we can characterize how brains are changing as they age. We'd like to look at that in relationship to how people remember things and perform on different kinds of cognitive tasks.
In looking at this neuroimaging, are you able, Jean, to, for example, predict or tell when somebody has started to develop Alzheimer's?
Well, no. Currently, we really don't have a good way to identify Alzheimer's disease early, although there are some developing techniques that look very exciting. There are techniques now that are coming out which we can use to characterize the pathology of the brain and image that in the brain directly, as well as how the neurons, the cells of the brain are functioning. And by having those kinds of abilities to detect that and have a window into the brain many years before the onset of the disease, we might be able to have ways to prevent it. And that's really the exciting research that's going on to develop new techniques to do that.
And would that, and this is for both of you, would that prevention be through a drug therapy, or would that be through the healthy living that you described?
It could be either, or a combination of those things. So one of the drugs that people are quite interested in are this class of drugs that decrease inflammation, for example. So there may be drugs that could help with decreasing inflammation as people age. But we also know that diet, for example, could also have a major impact on decreasing inflammation. So the best would be if we could do it through lifestyle factors, but it could be, particularly for those people who are at very high risk for developing Alzheimer's because of family history, et cetera, that we would want to add to that an actual drug regimen.
Okay. And we have about 30 seconds left. Is there, I mean, for example, Alzheimer's is seen as a problem of the aging. As people age and live longer, is this going to be a growing problem in the United States and the world?
It's absolutely huge. And as the baby boomers age, the number of individuals who have Alzheimer's and have a diagnosis is increasing at an alarming rate. And so by 2050, this is going to be a huge problem for the U.S. and actually around the world.
Lee and Jean, I want to thank you both very much for joining us today.
You're very welcome. Thank you.